So this is the webinar sponsored by the Children's Safety Network on preventing pediatric vehicular heat stroke. CSN is supported by the Health Resources and Services Administration, HRSA, of the U.S. Department of Health and Human Services under the Child and Adolescent Injury and Violence Prevention Resource Centers Cooperative Agreement for $5 million with 0% financed with non-governmental resources. This information or content and conclusions are those of the author and should not be construed as the official position or policy of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. Caitlin, I'll pass it over to you to just give some tech tips.
Great. Hello and welcome, everyone. I have a few tech tips for you today. First, the quality of your audio depends on the speed of your internet connection. If the audio is choppy, please find a more stable internet connection or listen over the phone by dialing one of the phone numbers found in the Zoom invitation. All participants are muted, but you can submit questions throughout the event using the Q&A button at the bottom of your screen, and we'll address those questions in the discussion portion of the webinar later on. For captions, please click the caption button at the bottom of your screen. Sometimes that's within the More icon, which is 3 dots at the bottom of your screen, and that will turn on automatic captions. And finally, we will be sharing our resources, recording, and slides within the next 2 weeks, posted on our website for you to access as well. Back to you, Becky.
Thanks, Caitlin. Hi, everyone. My name is Rebecca Spicer. I am an epidemiologist with the Impact Research in Columbia, Maryland. And my area is really understanding how technologies are preventing crashes and reducing the number of injuries. And under that greater spectrum includes hot vehicle deaths. And so there's a lot of new technologies coming out there right now to prevent these types of deaths. And our panelists today are really excited to hear what they have to say and what the latest information is. So without further ado, I would love to present our panelists to you. Jan Null has had 51 years of experience as a professional meteorologist. After a distinguished career of 24 years with the National Weather Service, he founded Golden Gate Weather Services in 1998. He has worked on over 750 cases over the years and is frequently called on as an expert witness in weather-related litigation, essentially CSI weather. One of Jan's primary research areas is pediatric vehicular heat stroke, and he's one of the country's most respected experts on this sad topic. His research, published by the American Academy of Pediatrics in 2005, is the go-to paper on the topic, both in the US and abroad. This work is kept up to date online at noheatstroke.org, and these links will be in the webinar information, that partially funded by a grant from the National Safety Council and NHTSA. Alexis Kagiliery, sorry, Alexis, is a nationally recognized leader in traffic safety with over 25 years of experience and currently serves as the program manager for pediatric vehicular heat stroke at the National Safety Council. She has extensive experience in child passenger safety and is dedicated to eliminating pediatric vehicular heat stroke deaths through strategic partnerships, policy, advocacy, and public education. She is a firm believer that collaboration is essential to expanding safety efforts and ensuring outreach reaches all communities across the United States. And so before we head on to our presentations, I want to remind all the remind the audience to, if you have any questions, to put them into the Q&A window that you'll see on your screen, and we will go over those questions and answers after the two presentations. So Jan, I'm going to hand it over to you.
Thank you very much, Becky, and it's great to see all the people that have joined us today. So if we start the presentation, as Becky said, I am a meteorologist. I am at San Jose State University, and I run and maintain the website noheatstroke.org, which I'll be referring to frequently in the next 20 minutes or so. Next slide. So these are some of the headlines that we have seen in recent days. Next. Fortunately, it's not all bad news. We're seeing more and more children rescued out of hot cars. Good thing, and you know, that's the direction we want to be going. Next. I need to add on top of this slide, there has been one death this year. It happened back on March 18th in Lakewood, New Jersey. Last year, there were 39 PVH deaths across the country, spreading from coast to coast, as we often see. Next. Over the last 26 years, the average number of heat stroke deaths is about 37 per year. We did see a dip during the first couple of years of the pandemic as people changed their the patterns of their lifestyle, how they transported children, people working from home more, things like that. Sadly, last year we saw that number go back to 39, so we're right back up into the long-term numbers. Next. Next. So heat stroke is a phase of hyperthermia. Hyperthermia is any elevated body temperature. Heat stroke, the clinical definition is when the body temperature gets to be 104 or higher. You can see some of the symptoms there. The flush, dry skin is a really interesting one because first responders, when they are coming to a scene of a possible heat stroke victim, they will look to see if the person is flushed, but they're not perspiring anymore. One of the things that happens with heat stroke is that the body starts shutting down systems, and one of those is perspiration. Next. Children are, and also the elderly are especially vulnerable. They don't cool themselves as effectively. Children's body temperatures are estimated to rise 3 to 5 times faster than in adults. And also children, especially in a car seat, where their back and their buttocks and their legs are up against the car seat, they can't perspire as well, and it's that perspiration that cools off the body. When the body temperature gets to 107 or so, the cells are damaged inside the organs shut down, and death can result rather rapidly, and or a permanent disability. Next. Next. So how did a meteorologist get involved with all these child safety people? So there was a death of a 5-month-old in San Jose, near where I lived at the time. The local media asked me, well, hey, Janet, who I'd worked with in the past, how hot could have gotten that car? I go, well, I can Google that. I can find you a quick answer. There weren't any good comprehensive studies out there. And so I started keeping track that year of temperatures in my own car. Next. The following summer in 2002, I started doing a study with a remote thermometer in my vehicle, one outside the vehicle, and I looked at 16 different days through the summer months with the outside air temperatures between 72 and 96 degrees. I looked from an initial starting time around midday for 60 minutes, and on two of those days, I had the windows cracked about 1.5 inches. Next. So cars heat up just like a greenhouse. The glass is transparent to the sun's shortwave energy, but it heats up objects inside, and those objects then give off long wave radiation, which is, you know, if you think of that nice little warm heater you have under your desk for winter mornings, that's that warm long wave energy is what warms you in the room. Same thing happens in a greenhouse. Next. And the same thing happens in a vehicle. That shortwave energy heats up objects inside the car. The windows are transparent to that. Your windows don't get real hot, but things like your dashboard, your seats, your steering wheel, we all know how hot those can get. And those then give off the long wave radiation that heats up the air inside the vehicle. Next. So here was the results of those 16 days that I talked about back in 2002. And the really interesting thing is as I started looking at the data was the the fact that all the lines are relatively parallel, and independent of whether you start down at 72 degrees or at 96 degrees, the rate of change was about the same. Next. And so if we average those rates of change, we came up with this chart. And so you can see after 10 minutes, the average temperature rise inside a vehicle after it's closed up is 19 degrees. After half an hour, 34 degrees. And then after an hour, about 43 degrees. Next. And then this is taking that data and mixing it with the outside temperatures versus the time. We can see what the various temperatures would be. The published study was going out through 90, 95, 96 degrees. But anecdotally, from looking at other instances in the interim, those rates of change are the same, whether even past 100 degrees. Next. This is a plot of 4 hours beginning at about 8 in the morning on a mild 63-degree morning. You can see that by about 10 o'clock in the morning, we're already above 110 degrees inside the vehicle, even though the temperature outside is still in the low 70s. By noontime, we're now almost at 140 degrees. And with the outside air temperature in a relatively mild reading of 85 for most of the country in summertime. Happening later in the day, you can see that the graph is sort of flattening out there, and with that average temperature rise in the middle 50s. Next. So in the first 10 minutes, you get about half the temperature rise. 80% of the rise is in the first 30 minutes, and then it plateaus, as we saw in that last chart, in the above 50 degrees or so. Those days that I cracked the window had minimal effect, 2-3 degrees on a couple of those days. When we're looking at temperatures of 130 degrees, 127 doesn't make a difference as far as survivability for a child. And one of the other important takeaways, it doesn't have to be a really hot day. It can be days. We've actually, the case earlier this year in New Jersey was a 68-degree day, and that was with springtime, lower sun angles. So also there is I call it an urban myth that dark cars are hotter than white cars. It turns out it's more likely the fact that dark cars typically have darker interiors than lighter cars. And you can test this yourself by putting your hand up by the dome light in your car. Not a lot of heat is coming through the sheet metal and through the headliner of your vehicle. Put your hand on the dashboard, and that's the heat's coming through the glass and heating up those objects. And this study, which I published in Pediatrics in 2005 with emergency medicine doctors from Stanford, Kathy McLaren and Jim Quinn, it's kept updated at noheatstroke.org. Next. Next. So the cases that I track in near real time on a daily basis are using some customized Google News searches, as well as contacts with media authorities. And also, I only look at publicly verifiable cases, not ones that are given to me anecdotally. There's a study done by NHTSA back in the early 2000s where they were looking at numbers averaging about 19 per year, where with media, and that was using death certificates and ICD codes. And with media reports, we actually found 37 per year. If you know of cases after you look at noheatstroke.org that I don't have in there, please let me know. We know there are cases out there that go under the radar. Next, please. So these next dozen or so slides are all from a document in noheatstroke.org called PVH by the numbers. So you don't have to do screen shares or grabs or anything like that. They're all there. And publicly available, the better distribution they get, the better. As you can see here, and as would be expected, we peak in the midsummer months, though we have had deaths in every month of the year. So we're not, there is no safe time to leave a child unattended in a car. Next. On average, the first death of the year is March 27th. This year, we were at March 18th. Next. So a little over half the cases where children are accidentally forgotten in vehicles. A parent or caregiver gets distracted. Something else happens in their life that they get out of the car and they leave the child behind. Of that almost 53%, 45% of that are where the child was not dropped off at childcare. And this is a really important aspect of this, in that if parents have arrangements with their daycare, their babysitter, their childcare facility, that if a child doesn't show up on a given day, that a call is made, that there's some communication. Almost 25% of all the cases could be saved. The next largest group are where they gain access on their own. These are typically 2 years and older. And this is where a car is left unlocked and a child gets into the vehicle and can't get out, maybe because the child safety seat's in the back seat. And so, again, this is all totally preventable. And then the final category where children are knowingly left, that's where a parent or caregiver makes a conscious decision to leave a child in the car while they go do some other activity. It might be an appointment. It might be they can't get childcare for work. It might be while they're meeting up with someone, going to a casino, going to a bar. There's lots and lots of bad reasons, all bad. Next. The numbers of forgotten cases per year has remained fairly steady at just around 20 per year, going back for the entire period of record that we have here. Next. And the number of gained access cases has fallen. The small dotted line there is a trend line, linear trend for this, and so we've seen that number has been decreasing. So that's all good news. All due to the efforts, I think, to get the message out about locking cars, not letting children get in them and to play in them. Next. Unfortunately, we have the opposite trend in the knowingly left category. That's an upward trend line where we've been seeing more cases where children are being left inside a vehicle unknowingly. Next. When I sussed out this data, I really found it interesting that we see this peak toward the latter part of the work week. One of the hypotheses is that this is the result of people being more stressed, having more things pile up during the course of the week. Next. As you see here, more than half the cases are less than 2 years of age, and we've had cases, about 4% are over 5 years of age, with a couple that are actually in their teens, and with the average age being 27 months. Next. It can happen to anyone. I've seen in tracking over 1,000 cases now since 1998. These instances in all three categories spread across the entire socioeconomic spectrum. Next. More than half the cases happen in the home driveway or very near the home. Another quarter at work, and then the other remaining cases are sort of spread out between childcare and other locations. Next. It doesn't have to be a blazing hot day. Yes, more than half the cases are 90 degrees or above, But as I mentioned earlier, that we have that those cases that happen in the 70s, and some of those are less than 70 degrees. Next. Geographically, as you would expect, the warmer states have a higher incidence, but there are only 2 states that do not have not had PVH deaths since 1998. Those being Alaska and New Hampshire. Sadly, Texas and Florida are way out in front. Next. A better way to look at those numbers is looking at per capita, where we're looking at per 1 million persons under 14 years of age or under. And you can see that the concentration in the southern tier of states, especially along the Gulf Coast. Next. There's a lot of detail here. This is probably best seen on the noheatstroke.org by the numbers document. But we can see that there's a higher percentage of the forgotten in Texas and Florida, and with California, even though having the next highest total, that number is less than the national average, but their numbers of knowingly left are higher. So lots of information here that hopefully you, as people involved in this topic, can use for messaging and to bring all these numbers down. Next. Next. So 21 states have laws against leaving children unattended in vehicles. Note at the bottom, 32 states have laws against unattended pets in vehicles. I will offer that without comment. There's also several states. You'll see Florida with 15 minutes, Missouri with 10 minutes, and Texas with 5 minutes. The law allows you to leave a child unattended in those states in those amounts of time. So those laws are particularly ineffective. Next. We've seen, especially in the last dozen years or so, an increase in number of states that have Good Samaritan laws related to rescuing children and pets from vehicles, where the person is not held criminally liable. Next. You can see the numbers here. If in the knowingly left category, those are much more likely to be charged than in the forgotten category. If it's a paid child care provider, they're more likely to be charged. And running counter to sort of what a lot of the social media people would say, oh, these are all people on drugs and alcohol, and that just has not proven to be the case. Next. Technology. Again, just a quick reminder about these numbers. Next. So there's 3 different types of systems that are being used. One are just reminders, and as in this model year 2025, those are required in all new vehicles in the United States. Then there are sensors that actually physically note the presence of a person, and then there's apps for phone, things like Waze and lights flashing and things like that. Next. So the reminder systems, they're door logic, whether you open the back door to put child in or out, detection systems like radar and infrared, and these don't count like car seats in particular and other independent apps. Next. So the number of forgotten cases, reminder systems can help with that. And gained access, you would need a detection system, and knowingly left, how that gets monitored by technology, I don't have the answer for that. Next. But the negative part of the technology, and especially now, even with it going into new vehicles, only 31% of the new car buyers are less than 45 years of age, and only 38% of used car buyers are less than 45 years of age. So those are the the most likely to people to be transporting children. So it's not getting to the whole market. Next. So if we were to implement the system starting this year and expand it out for the next 20 years, there would be, with no warning systems, there would be 748 deaths. That's our average of 37 per year. With warning systems, there would still be 523 deaths. We would only be saving about 30% of the deaths. Next. So that's why technology does save lives, but it's going to take obviously a lot longer. And historically, the last people to get new cars and technology are those that predict the underserved portions of society. Next. So we need to have that overlay of a multi-faceted approach between not just technology systems, but also with the continued education. Next. Never leave a child unattended in a car for any amount of time. If children are missing, check the pool, then all vehicles. Next. Get habits so that you look before you lock. Have different types of reminder systems available. Next. Next. As I said earlier, almost everything here is at noheatstroke.org. There's the National Safety Council, which Alexis will be talking about, is available with a great online course. And feel free to reach out to me at jnull@noheatstroke.org. Thank you very much. Thanks you all for attending.
Thank you, Jan. I think that your work over the last few decades actually is one of the reasons we understand the depth, the magnitude, and the breadth of this problem. So thank you so much for all your work over all these years. So I am going to hand it over to Alexis, and she will get going. Thanks.
Great. Yes, and thank you, Jan. Good afternoon, everyone. My name is Alexis Kagiliery. I'm the program manager for the National Vehicular Heatstroke campaign at the National Safety Council. First, I'd like to thank CSN for inviting us to speak today. It's perfect timing because tomorrow, May 1st, it's National Heatstroke Prevention Day. Today, I'm going to share 2 new initiatives that are available to everyone. It is all about collaboration, sharing knowledge, and providing turnkey resources that take minimal time to implement because you are all so busy, but can make a major impact within your communities. These resources are designed to help you quickly educate your partners and stakeholders and raise awareness about this critical issue. Next. The first opportunity is an open invitation for all of you to join the National PVH Stakeholders Work Group. The work group was formed to bring together experts, advocates, and organizations to address this complex and 100% preventable issue through a systems approach. The work group includes members from a variety of backgrounds: public health, transportation, law enforcement, child advocacy, technology research, and parent advocates, and many more. We meet quarterly to collaborate, share data and emerging issues to advance national prevention strategies. The QR code on the side, you can click on that. They'll take you to cpsboard.org website where you can learn about the work group, how to sign up, and how to be able to send in your member application. To drive progress between meetings, subcommittees focused on key areas. Together, the work groups develop and promote effective countermeasures from education to outreach materials to technology, innovation, and legislative solutions, all aimed at achieving a shared goal of eliminating preventable hot car deaths. Next. The 3 subcommittees are the Communications Subcommittee, focused on creating a turnkey, ready-to-use national PVH communication packet. The group decided this packet would be designed for employers to educate their staff and customers on the dangers of vehicular heat stroke. It will include practical, impactful tools such as customizable emails, making it easier for you to communicate, window clings, parking lot signs, posters, and a 10-minute NSE e-learning module titled Children Hot Cars. along with many other useful resources. The goal is to make raising awareness simple, accessible, and widespread, and you can find it all on the cpsboard.org website under heat stroke on the right rail. There's the Legislation and Policy Subcommittee is working on developing a best practice guide with resources for childcare centers. This guide will support current legislation or provide time for licensed childcare facilities, which could be corporate, private, or home, to enhance or implement best practices to support new legislation or enhance existing laws in the future. The guide will include safe transportation procedures, immediate attendance checks, active supervision, and emergency response protocols. These recommendations will serve as a foundation for consistent, impactful advocacy and implementation across the country. Lastly, we have the State Task Force Development and Support Subcommittee, which is focusing on capacity building. They are curating a library of impactful videos, up to 10 minutes, presentations from national leaders, experts in emerging vehicle safety technologies and research, and that is coming soon. Next, please. The beauty of developing the state task force model, which is our second initiative, is each state will look a little different, and we can share the nuances with other states. NSC provides recommendations, best practice, and turnkey resources that can be customized to meet the needs of individual states. Texas developed their very first state task force back in 2015, when fatalities rose and Johnny Humphreys and advocates came together to address the elevated numbers by establishing the first task force. They are still going strong, and we look to them for guidance as we develop the task force model and resources. In 2024, Florida came aboard and is being utilized to help develop the model for the task force. This is the first year for Florida to observe Hot Car Death Prevention Month, thanks to ARIA's Act. The Florida Task Force members supported the state's efforts by hosting press conferences, social media campaigns, and tracking all of their activities. Virginia is actively recruiting with over 20 member applications submitted, and their first meeting was just last week. They're just starting to organize with identifying a chair and a secretary, scheduling monthly meetings. Minnesota is getting started and incorporating the task force into their state office. We are providing the co-branded materials and the Safety Connection platform, which is through NSC, that supports the state task force web pages. And we'll link directly to their Minnesota website. Next. Here's some sample objectives of the task forces. Build a multidisciplinary task force. Identify and recruit and engage key stakeholders from various sectors. You all have work in different sectors, but coming together to be able to collaborate. Raise public awareness, implement targeted educational campaigns to inform caregivers about the dangers of PVH. And tomorrow is a wonderful opportunity for you to raise awareness with National Heat Stroke Prevention Day. Engage non-traditional partners. Everyone walks through a parking lot. Bystanders and businesses can play a vital role in prevention. Everyone walks through a parking lot and can save a life if empowered to take action. Facilitate online training and outreach. Provide educational materials and training for caregivers, childcare providers, community organizations, and companies using the e-learning Children in Hot Cars 10-minute training that NSC has. It's already done. And also, too, there is a guide for admin folks. So if you have a childcare director who wants all of their employees to take this course every year, there is a mechanism for them to be able to do that and track their employees' progress. Develop legislation and policy recommendations, track PVH activities. And when you go to our websites for the states, you'll see that on the bottom that the members can register their events. This helps be able to look where the activities are happening and look down the road to fill in those gaps. Encourage community involvement. You want to mobilize local advocates and volunteers to support grassroots awareness campaigns. Next slide. So this is a natural fit. As safety professionals and advocates, you are already doing the critical work of protecting lives. And that's exactly why forming a state-level task force is a natural fit. This is an opportunity to take the lead within your state and bring visibility to an issue that's entirely preventable. By creating an official forum for collaboration, you can bring together both traditional and non-traditional partners together. A task force also provides structure to track outreach efforts, share resources, and identify gaps in education or engage across communities in your state. Best of all, they're free. Value-added programming available, turnkey resources, expert presentations, and subject support that you can just plug right into your efforts. You don't have to build anything from scratch. This is about taking what we already do best, protecting the most vulnerable, and expanding their impact with a focused, collaborative approach. Next. The National Safety Council is managing this initiative and available to assist states throughout this process, offering guidance, resources, and support to help task forces launch and sustain effective prevention efforts. The statewide guide serves as a resource to help states establish a state task force tailored to their specific needs and priorities. The structure, roles, and subcommittees outlined in this guide are only suggestions designed to provide a strong foundation for statewide efforts. Task forces are encouraged to customize their structure, leadership, and outreach strategies to align with their local communities. Whether building a task force from the ground up or enhancing an existing initiative, this guide provides flexible recommendations that can be adapted to ensure maximum impact. Next. Once you've made the decision to start a task force, the next step is these key building blocks to put them in place. We have found that starting a member recruitment is very important. You think broad, pull in traditional safety partners, but also those non-traditional ones that I referred to who will expand your reach. Child pasture safety technicians, pediatricians, fleet managers, first responders, retailers. How about veterinarians? NSC provides an online member application and can customize emails to potential members. Next, establish monthly meetings to keep momentum going. These regular touch points will help maintain engagement, track progress, and build accountability along with your partners. To give your task force a recognizable identity, consider creating a state-specific logo. It doesn't have to be fancy, just something that helps unify your outreach materials and build visibility. Then launch a dedicated state webpage. NSC has the model already with resources already designed, ready for co-branding, and I'll show them to you in a minute. This simple landing page that houses key information, content details, and links to shareable resources. It will provide a home base for your task force and gives the public and your stakeholders a place to connect. Finally, work with your group to identify messaging and resources that resonate with your state communities. You will see that the messaging that I'm going to show you in a minute is a collaborative of the individuals that we work with within the states, and also to aligns with Jan's statistics. These fundamental steps not only help you launch a task force, but set up for a long-term impact in preventing these completely avoidable tragedies. Next. The first step is to identify and assign the executive committee. Develop clear leadership structure to provide direction, accountability, and sustainability. Define positions and roles with an executive committee to help organize efforts and drive action. And then your group can decide if you would need subcommittees or not. People work a lot of hours. They have many different hats. So maybe subcommittees won't work as well. We found that in the state of Florida. Next. So let's get into the messaging. Well, when crafting messaging, we avoid fear-based messaging. Instead, focus on awareness, education, and empowerment. The assets have been developed to focus on, as you can see, it has a common theme with Jan, the forgotten, which is 53%. These are often loving, attentive caregivers who experience a change in routine or momentary lapse in memory. Messaging should be empathetic and focused on prevention strategies with visual cues, reminders, and technology. That gained access, 25%. These cases involve children entering an unlocked vehicle on their own and becoming trapped. Messaging could emphasize supervision and the importance of keeping vehicles locked and keys out of reach. Knowingly left, 21%. These less common, these situations occur when a child is left intentionally, often because the caregiver underestimates the danger. Messaging here should stress that no amount of time is safe and even quick errands can turn into tragedy. Vehicle temperature, a core part of the messaging, should include the science. A car can heat up rapidly even on a mild day, and a child's body temperature rises 3 to 5 times faster than an adult's, making every second count. Visual aids like temperature charts and time-lapse videos like Jan has can be effective in illustrating this danger. And bystander intervention, empower the public to act. Messaging should include what to do if you see a child alone in a vehicle, when to call 911, when it's legally permissible to intervene, and how to do so safely. And then you'll see the state specific that I referenced in the side. Florida task force has decided to be called the Florida Vehicular Heatstroke Task Force because they're going to be focusing on not only pediatrics, but vulnerable adults, pets, and the unhoused. Next. So here are our assets that I wanted to share with you that are available on the websites that are going to be given to you today. So we have the forgotten message, look before you lock, check the back seat, stay alert. A simple change in routine, distraction, or exhaustion can change your life forever. On the bottom there, you'll see that we have the NSC logo, but on the right would be, you could have it customized for your state to have the web page that we have on the QR code, and then on the left could be your state logo. Gained access, unlocked cars can be dangerous. Children and unlocked cars do not mix. Always lock your car, even in your driveway. Keep keys and fobs out of reach. Teach children that cars are not play areas. Check your car if a child goes missing. Very simple. And if you can see that this messaging is at a 3rd to 5th grade reading level. Next. Then we have the knowingly left. Never leave your child alone in a parked car. And we talk about a child's body heats up 3 to 5 times faster than an adult's, and it only takes 10 minutes for a parked car's temperature to rise more than 19 degrees. This really shows this messaging, you must act. This is, you should never leave a child alone in a vehicle, but also too, this shows why you come up on a car, you never know how long a child has been in there, and these factors need to be considered in. Vehicle temperature, as you can see, it's 121 on top and 72 degrees out. This was a picture taken at this April's Florida event. A child's body heat, talking about the temperature, and also, so call 911, so take action. Next. We also have infographics. Children in unlocked cars do not mix, and look before you lock, keeping it very simple messaging. Next. We have window clings. The one on the left can't be co-branded, but the one on the right can be. Next. Parking lot signs. Well, when we went to develop these, we started with the state of Florida and realized that a palm tree is not going to work in the Northeast. So we have an oak tree. So you have the choice between a palm tree or an oak tree. These are parking lot signs. Everything that you're seeing can be done in grayscale and printed. So, so that works. Next. Talking points. We provide talking points that you can have and provide your stakeholders, if they're ever called upon, to be able to have the statistics in front of them or some talking points. Next. And then this is real important. This is the free Children in Hot Cars e-learning tool that we have at National Safety Council. It's 10 minutes. And you, on the right, there's a QR code for the group admin options. So if I was like a childcare provider, like I spoke about, I could be able to assign all of my employees to this group administrator option to be able to take this course annually and be able to track the progress. Next. Toolkits. You'll see that there are different toolkits that are going to be available, that are available. Actually, they went up this morning, but there's an advocate, childcare and hospital, employer, retailer, corporate, and indigenous communities. Next. And so here are all the websites that we have that you will be able to go on. The national resources are all going to be on the cpsboard.org website, where the state and local resources are going to be on the Safety Connection. And through Safety Connection is where you're going to have all of the state task forces, Florida, Virginia, and Texas, and also Minnesota is going to be added, The difference with Minnesota is that we're going to have this link, but this link is going to be directed directly to their Minnesota website. So each state doesn't necessarily have to have one of our web pages, but go on and check it out to be able to look at all the resources. The resources that I just showed you are in all the different toolkits. So we did the toolkits so someone who is a retailer can go on and say, oh, retail, this is for me. They don't have to go through everything. They can just click it on and be able to get customizable emails and everything that they need. Next. So this is the state task force guide that you can find on the cps.org website. This gives you some ideas, some suggestions to be able to starting a task force, have it be an easy lift. In the state of Florida, I can tell you that the Secretariat helps tremendously by taking meeting minutes. We tape all of our meetings, and then the meeting minutes are done and agreed upon in the next meeting. And we also too post them. So if you go into the Florida website, that link that you just got, you'll be able to see all of the meetings with our agendas and also to a video, tape video of our meeting and also to the meeting minutes. And so this could be helpful in helping you make that decision. But know that we can customize this to make sure the lift is really easy and that you have what you need. And I'm here to be able to support any states that would like to be able to start a task force. Next. So tomorrow's really exciting. So everyone get their phone out and click on this QR code. And it has a social media playbook, which you can be able to use the social media posts right out of. So please, I know 77% said that they are actively doing raising awareness, and we have the other percent. This makes it really easy and turnkey for you to send it out to your friends, your family, your colleagues, and push it out there into the universe. Because tomorrow is the first official day that we start. Unfortunately, we have one fatality though, so far for May 1st. But thank you very much. Next. Here you go. You can email me at hotcars@nsc.org. And there's my information. I am here to be able to provide support. Please join the National Stakeholders Work Group with us. And also too, if you want to start a state task force, just send me an email. Thank you so much for having me.
Thanks, Alexis, for all of your hard work on this. And we are going to head into the question and answer section. If you haven't asked your question, you have a question, go ahead and enter it into the list there. So we'll just go ahead and get started. And I just, these are for Jan probably, but Alexis may also want to chime in. There are some questions regarding data that are related. Is there an interactive or live dashboard that can use the data? People, another person asked if you can create a state profile or using the data or a breakdown of circumstances in which the child was forgotten. Is there an interactive element to the dashboard?
Well, there's not a dashboard specifically, but there are, there are all the cases going back to 1998 are available on noheatstroke.org. In the by the numbers document I have, and it was one of the charts I showed, I think it was from figure 16 from the by the numbers, which breaks down the circumstances by state. If any person though, wants a breakdown for their particular state, drop me a note and I can work that data out for you. Is probably the easiest way.
Great, thank you. Another question for either of you. Many owners disable the reminder system, arguing that it is annoying. Is there any data correlating between vehicle deaths and the disable reminder system? Do we have any data on that or information on that? I imagine it's a numbers issue because they're still fairly rare, and to correlate the two might be difficult. But.
Yeah, it's the sample size is very small. Anecdotally, we've heard of a couple cases where it was disabled, but nothing, that is documentable that I would certainly run with.
Okay. There were two questions, and I think some of this was covered in your presentations, but I just want to ask them again because just for emphasis, what is your response to someone who sees a child or pet in a car in a parking lot? Do they call 911 and wait for help to arrive? Do they save the child or the pet? And then there was also a question on what are the Good Samaritan, what are the states that had Good Samaritan laws?
Great question, Rebecca. What we're saying is that people should look in their environment, walking through if they see a child or a pet in a vehicle, stop and look around and then call 911 if they feel that it's in distress. But 911 will tell them what to do, what's the next steps to be able to do and what they have to do. So that's what we're saying is that stop, take action, and call 911.
And as far as the Good Samaritan laws, the map that I showed, and I think everyone's going to have access to all those slides later,
Right.
as well as at noheatstroke.org, has highlighted all the states that have the Good Samaritan laws with links to those state laws. Now, going back to Good Samaritan acts, even in states without the Good Samaritan laws, in doing this now for over 20 years, I have yet to see anyone be prosecuted for rescuing a child.
Mm-hmm. Mm-hmm. All right. Jan, real quickly, reminder, what were the days of the week that it is believed that vehicle deaths are higher due to individuals possibly being more stressed?
So those were Thursday and Friday. They were almost
Okay.
Almost equal numbers on both.
Okay. Next question from Wendy King. So I'm putting this out to everybody. Is anyone hearing any discussion about organizing a task force in North Carolina?
I haven't yet. However, if Wendy feels that this is something I'd like to bring to North Carolina, it doesn't necessarily mean that she has to chair it, but she could be able to talk to her fellow stakeholders in the state and give me a call, and we can look at it and bring people together. Between a lot of folks that sit on the national work group and that have the interest, we could convene a group of stakeholders within North Carolina to see if that's feasible, but I haven't heard of one yet, but love to do it.
And just a reminder, all the slides and contact information will be on the internet underneath this webinar information. Let's see, I think, Alexis, this was pertaining to all the resources that you were presenting. Can CPSTs access all these through our online accounts?
You don't need an online account. The wonderful thing is that you can go on cpsboard.org, which is the open site under heat stroke, and those are all the national. But then you could go onto the safety.connection/connections, which was given, and all this information is there. So they can go underneath the individual states and be able to pull all of the universal resources out to be able to use it.
Great, thank you. And are these posters available in Spanish to share with the Puerto Rican population?
That's a great question, and that will be the next step that we need to look at. We just got everything done today to be ready to go for tomorrow, so that would be something that we're going to work towards.
Mm-hmm. All right, let's see. So the question from Susan Pollack was, wonder if we can start to note in the data if the child was left in the car because no child care, as last year work-related death and mom was charged in parentheses. And also if child was in car because of homelessness. So essentially she's asking if, is there a way to identify in the data whether the child was left in the car because they just were homeless and that they had no child care. It's just a place where they keep their kid.
There is, again, on noheatstroke.org, associated with each individual case is a link to a media article. And those often will have some of that information in them. We haven't started tracking that in a specific manner, and to go back to do that for previous times would be I think an impossible task. But it's something that whether we have the numbers or not, and Alexis was talking about especially addressing that, like with the Florida group, that's one of their priorities. So, yeah, bottom line, we don't have the specific numbers, but it needs to certainly be addressed with advocacy.
Mhm. Okay, I think we have just time for a couple more questions. Have any communities utilized messaging from local, well-recognized auto dealers via TV ads? Likely each community has recognizable auto dealers that advertise, and it seems like a great collaboration for prevention messages via TV and online. Any knowledge of that sort of collaboration? No.
It's not something that I've seen, though. When I was first doing my study, I had approached a couple auto dealers about sampling data, with black cars and white cars, where they had all lined up out there, and nobody wanted to be associated with it.
Okay. And one final question. Where can we find preventive material messaging for home visitors to provide to parents of children from birth to 2-year-old? Alexis, do you think that?
Well, you could use the resources that were provided underneath the hospital toolkit that's on the website. And there's an infographic that I showed you. There's 2 of them that you could use for home visitors. And if there's something that needs to be developed, please reach out to me, because we're continually looking at what the need is. We've set the foundation right now, and now it's time to build upon it. So we're open to recommendations.
All right. So we maybe have time for one more question. Let's see. What do you say to caregivers to say that leave their child pet in the car, but leave the car running with the AC on? What do you say to caregivers who do that? They leave the AC on, but they leave the pet and child in the car.
An unsupervised child and pet is still as dangerous. Heat stroke, hot cars is the top mechanism for fatalities, but also supervision is key, and it's never safe to leave a child or a pet in the car by themselves, especially if the engine is running.
All right.
That would be what I'd recommend.
All right. So it looks like we've answered just about all the questions. And I think now is just a really good time to thank everybody for your participation. Alexis and Jan, thank you so much for your presentations. Please fill in our brief webinar, our brief evaluation, and you can go get the notes and the presentations from online at childrensafetynetwork.org. And so I think this is where we'll say goodbye.